It started with one and has grown to 5. The Coachella Valley, Houston, Northeast Florida, Little Rock, and Adams County, Mississippi. These are the communities where the Clinton Foundation's Health Matters initiative is working, bringing the right people together to transform the health and well-being of community members. Because access to good health is a basic need for all residents, regardless of zip code or demographics. It's not about telling communities what they need. For the Clinton Foundation's Health Matters initiative, it's about convening people, giving them the tools and the connections they need to make dramatic improvements in health. The Clinton Foundation's Health Matters initiative starts by developing a regional blueprint for action, a 5-year strategic plan created with input from more than 150 stakeholders in each region, setting local priorities and outlining action steps to improve health indicators unique to each community. In the end, the goal is to empower communities to become self-sustaining with systematic health changes for generations to come. 5 may sound small, but these community health transformation programs will reach 8 million people, and together, we can reach many more.
Today is about the opportunity to call things by name and to say, we know where we are as a community, we know we're not where we should be or we wouldn't have this work to do, but this is the opportunity. So if we don't say it now, if we don't put it on the table, then Adams County loses all of your neighbors who were not able to participate today, all of the children who are coming up now who weren't able to participate today, they lose.
Adams County is really the only community in the 5 that we're in that is very extremely rural. So it's a rural community. It's a community that has a rich history, proud people, but really they want to embrace and totally embrace our mission on decreasing the prevalence of chronic disease.
Where I would hope a program like this could help us figure out how to educate our population on what those things are that they could be doing every day to make themselves healthy, and then they wouldn't need guys like me or hospitals.
What I appreciated the Clinton Foundation did, they did not let just the leaders come in and say what the community needed. They had everybody that in the community that's going to be affected by it. You would not be surprised how overwhelmed some of the individuals were that I contacted, knowing that they was going to be a part of something like this to say, hey, this is what we need in our community. But the end result is what I'm excited about, a healthier Adams County because of something like this taking place and, and moving forward.
I've seen great innovative ideas come out of communities. So from emergency room diversion programs, from Get Tested Coachella Valley, communities saying that they want to implement fresh fruits and vegetable markets, from schools creating school gardens so that those fruits and vegetables are used in their school lunch program. These are easy ideas to complex health problems that others can emulate.
The opportunity with the Farm to Family truck was to create socioeconomic change within the community of Hastings. We have high rates of unemployment. With the truck, we saw the opportunity to provide fair-paying jobs and housing and all of those things that we didn't have access to at all.
Farms Environment is about helping people, getting the good quality fresh fruits and vegetables out.
Knowing about food deserts, to come up with a mobile truck to get the produce, which Hastings is known for, out to people who don't have access to it.
I'm helping people get the right vegetables, and it's been a real difference in my life. I'm focused on my life, focused on Farms to Family, saving money, working with good people, so I really enjoy it.
People should think of health, and not just individuals. So corporations, organizations should think of health as a right. It is not a privilege. So one of the things that we ask communities to do is to create bold action steps. The Get Tested Coachella Valley campaign, which looked at testing any resident over the age of 12 for HIV and AIDS. That is a big, bold action step, given that the Coachella Valley has a large population, but really belies and underscores the importance that the community felt this issue had.
Our vision is that we end the transmission of HIV in our community, which is right now double the national average. And when we're able to do that, we want to bring this to other regions of the United States and see the day that new HIV infections are no longer one every 9.5 minutes, but become one every 9.5 months.
I think one thing I've seen here in the Coachella Valley is that because this area is large but is small, so we already had, a lot of the groups that would work together. But I think what the Clinton Health Matters Initiative has done is it's gotten us all at the table. It kind of breaks down all of those barriers and all of that competition to look at what can we do to make the Coachella Valley a better place for everyone. And I don't think we could have gotten there without the Clinton Health Matters Initiative.
What I'm hoping to see is a movement and a wave across this country where people say, I will not be restricted from asking for and creating a healthier community for myself and my family, because we believe that we deserve it, and I believe that they deserve it as well.
This is an opportunity for us to really normalize HIV testing as a public health issue.
A healthy community, it means a healthier me, a healthy you, a healthy community. It means that we have set the standards for a longer life, a healthier life for individuals in Adams County.
And it's about partnerships. When we started this, we had no clue. I didn't know how to drive a truck. Now I do. Being a part of a bigger plan certainly is very important.
I think it's well worth it to be able to take an organization like the Clinton Health Matters Initiative and pull communities together, pull resources together, and be able to educate communities and provide a way for individuals and communities to be a part of their own health care is really significant, and it can definitely help people live longer, more productive lives, and it can keep those healthcare dollars down that we talk about so often.